Well, here we are, Renee. This is odd, is it not?
This is odd. We look like we're on a green screen, but we're not.
That's real. We're on a corner in Louisiana.
Lafayette, Louisiana. I was told this big old thing behind us is because it's Catholic down here, and they built a lot of.
It is, yeah.
I'm not sure. The parishes are all named on that building back there. So we're going to learn more about this after this conference, I think.
A whole lot of history. And we couldn't actually pack our usual podcasting microphones. So we've got the road gear. It was quite a travel day to get down here, to say the least. But we have a lot of interesting things to share.
We do. So everyone, we got down yesterday. And for those that are not aware, we're traveling during the tail end of the shutdown. So we weren't really sure if we were going to make it or how to make it and all those things. So we did end up making it. Just some delays, some strange things where the gate didn't come to get us. So we were sitting on a tarmac for a minute, delay leaving again. And there was something about mechanical issue, but they had to run the paperwork out to the plane while we were already out on the runway. So that's new.
I got to watch some good movies though. And, most importantly, here in Louisiana, we're learning a lot about healthcare and behavioral healthcare.
We're learning a lot. So, but before we dive into what we've learned, what is happening on the farm while you're in Louisiana today, do you think?
They were hauling grain again. It seems like every time I go out of state, we're just hauling more grain out. So I get to see on my camera. That's called remote farming, I guess. I just kind of phone it in. So
a friend.
Yeah. Yep.
So this whole weekend, we'll start with how we started. We got to town. We went to dinner. Well, actually, first things first, we stopped in Baton Rouge on our way.
We did.
Had some lunch. But we've learned that there's a lot of traffic here.
There is a lot of traffic. There's not a lot of traffic planning around some of the roads, and there's some big rivers, right? And so there's one bridge that everybody crosses.
Lanes for sure, not enough lanes.
No.
And so it got everywhere a lot slower than what we thought. So we got to dinner, and we were there in Lafayette at, what was the name of the place?
Bontemps. It's rated number 1. And
rated number 1?
It was Pat's birthday, and Pat was having a surprise birthday party.
Yep.
Right. That was kind of weird. We got seated in the back room, and there's like a partition, but Pat's family came out to surprise her
on our side
in the restaurant side. And so everyone in the restaurant, there's a couple tables of us that were suddenly included in Pat's 75th birthday party. So we talked to Pat's daughter. We were able to videotape the big surprise. It was fantastic. And so, maybe we'll post Pat's video on our social channels as well.
Definitely should.
We might do that.
People, though, that are questioning on Jason's socials, who's Pat? And as you should, because we don't know.
Yeah. So that was a lot of fun, right? And that how we manage work, work stress, if you will, is we keep a routine, right? It's like the meals are on routine. Even though we were on early flights yesterday, I was in bed early because I need 8 hours of sleep.
Agreed.
We were lucky enough to keynote a presentation here in Louisiana. We kicked off the conference on the Rural Health Conference. And we were there in a room full of CEOs, COOs of rural health clinics and critical access hospitals all across the great state of Louisiana.
Yep. What I really appreciated was we got here early to the conference and got to speak to a lot of vendors. And they were very kind because I could ask some questions. Yep. I wanted to know for sure who was in the room because it's always important. Remember when we were going to build that of how to do a conference? Because we always talk about how bad it is.
Yep.
Knowing who's in the room should be number 1 if you're a speaker, because you should speak your stories to the people in the room. And we learned they were all hospital execs, CEOs, rural clinics, critical access hospitals. So we knew the room, but we also could ask questions about some system things that we could then put into our talk, which was really helpful.
Right. I was able to connect with the person in charge of the mobile crisis system that just started in May. And I said, tell me how it's really going, because I was just chatting and she's like, can I tell you how it's really, really going? I'm like, yes. And she said, it's going horribly because we're having a tough time implementing it. It's fragmented. There's silos. Some people won't talk to me, and we know cities like New Orleans, the police department's been having to do mobile crisis for a decade. They've got a system down, but the task is going to rural sheriffs in all the different parishes, right? Because they're parishes, not counties here. And she goes, we have to do it by department by department. I said, I'll be honest with you. This sounds just like Iowa, Indiana, Illinois, Ohio, right? I went through the list, Nebraska, South Dakota, North Dakota. Like this is what you're experiencing isn't anything different, right? And I really appreciate you being honest with me about that.
Yep. So we went into the talk really prepared pretty well. I guess the only thing we didn't really know is that we should have talked less time, but they didn't tell us, so whatever.
Supposedly I talk too much, but I blame Renee for that
Oh, please.
because
No, I
we
was
went
way more quiet.
we,
than
we
you.
were still done within the time before the next person started. However,
Whatever. So it was good. We kind of tailored our talk this time, and we put some slides specific to Louisiana
yeah,
in there, specifically prison and jail. They incarcerate people a lot higher than the
almost
national average.
double the national
Crazy.
average.
It was a lot of conversation. I think it finally landed for them as we talked about, like, this is a red state. Republicans have to understand the cost of taxpayers
Yeah.
for prison and state hospitals. That's how you get movement to lower level of care, is when they figure out that you, as a state, pay 100% of people incarcerated because you can't draw down Medicare, Medicaid, or Social Security,
Absolutely.
and you can't in state hospitals either. If you can't really break through, because this audience did not sound like they had a lot of cooperation with their legislators.
No.
Nobody's listening. You know the drill. And it's like, well, you have to speak the language of the people elected. Tax dollars in a red state will talk.
Yeah.
And so we talked a lot about that. And I think that was helpful once we sort of put some context to what we were saying. I don't know if they don't know who Iowa is. I mean, we're a pretty red state. How
Yeah.
did they not know? But I don't think
Yeah.
they knew. So as soon as I said, we're a red state too, you could see some resignation. It's like, you still have to have help. And so it was good to talk about that. The other thing that we really dove into this time different, you can talk about this more, is a continuum of care.
Yeah.
And by the looks on their faces, they had not had that conversation before.
You know,
can tell.
if you follow our channel, you listen to our podcast, you'll know that we've spent a lot of time in some of our projects we did. Brent and I did a project last year in Nebraska, and the focus was really on the continuum of care. You know, we drew out a triangle and we put acute hospitalization, state hospital at the very top of that triangle. And we wrote through all the way down to the lowest, you know, to prevention and all of the different services that the state delivers that plug into that. And from that, we can identify gaps, and we can do that at a state level. We can do that at a local level. It's been really a good tool to use. We've used that a little bit back in our home state of Iowa on a project we're doing. And so that's really become kind of our model of, this is how we can talk about this, simplify the message. There was some aha moments today. I could see in people's faces. They're like,
Yep.
we've never thought of it like this. We've never talked about it like this. And it does seem really simple to me, Renee, as
I
to
go
how
to
that.
do a little soapbox again. So if you haven't heard it, you're going to hear it now. But if you're in a crisis in a hospital for mental health crisis, like going to kill yourself, whatever, and you get handed a card for outpatient,
Yeah.
and it's 6 weeks, 6 months, you would never do that to a cardiac patient. Ever. If you're in
Yep.
chest pain, you don't say, here's an outpatient card, so you know, follow up with your cardiologist in 6 months. So why in the world, if somebody's suicidal, are we handing them an outpatient card and expecting them to be alive at whatever date that is? It's insane. And so you could see the recognition in the room. And on the continuum of care, them in the hospital is way at the top. Outpatient is about 6 or 7 layers
Yeah.
deep. And so I'm like, you jumped from here to down here and skipped every other level of care that could have helped somebody stay alive. And they were concerned. The people I talked to before were talking about suicide rates, and then they have a lot of concerns in that in their rural communities as well, just like we do.
Yep.
And when you have nothing in between. It's like, you shouldn't be shocked if somebody kills themselves because they came and told you. If they made it all the way to you and said, hey, I don't feel good, I don't feel like living, and you did not do enough, you cannot be shocked then if they're dead in a couple of days.
That's exactly
And it's really sad. But it was another opportunity because you could see your visual that, hey, you're talking down here,
right,
and where we are is up here, and this is a gap, and not even a small gap. And even the people in the room, I think I met telehealth outpatient.
Yeah.
Now they do some stuff in a hospital, but nothing like actual treatment levels. And I met prevention. There's some ladies that do some perinatal prevention.
Yes.
They had a really cool program that I'd never heard of before, where they consult with docs. If you're anywhere before having birth to 21 years of age, a provider can call them to get information about behavioral health issues. That's kind of
an echo program for behavioral health. That sounds really cool.
Never heard of that before, but that's it.
Yeah.
And there was an obesity program that they were sitting in the room and had never tied the connection to mental health till I said it. And I said, you understand, if children are obese, that means they're not getting the exercise outside time that causes the mental health concerns.
Absolutely.
I said, so your obese program is awesome because you can deal with mental health. And they were like, we never thought of that.
Yeah.
And that seems like an obvious connection
in
my head.
And this is goes back to, it's convening, having conversations, right? This first step in recognizing and doing this is having folks come in and think about things differently. And I think so oftentimes this is where we see folks just get dug into their regular everyday to day, heads down, and they don't take the time to step back or invite someone else in from somewhere else to share a different perspective. And I think that's what's so great about going to these conferences is we learn just as much as the people that we're speaking to, because we all get to share different perspective and just viewpoints. And we can say, you're not alone in this, that we've seen the same problem over and over again. And here's a couple of folks you could call or some solutions that can help.
Right. And interestingly enough, we've met some people that say they are some solutions, which is awesome. Great to talk to them. But like through that presentation, it was interesting to see when people were resonating and not. And now something new happened today after our presentation. I had people walk up to me with pages of notes. This doesn't happen often, but it did today. And Jason had to go to another meeting.
I did.
So I got left for an hour and a half maybe, of talking to other people, which was interesting. But before we get into that, let's talk about the guy we just left. So there's a guy out there now who's arguing that he shouldn't have to have capitated rates, and that all of this stuff that was said about how poor healthcare is really just mumbo jumbo, and that they really know how to do the right thing if they just got paid fee for service. That was his entire argument. And it was like, we do it best. We know what we're doing. And all these people are messing it up for us. And I'm sitting there going, okay, that is a speaker on your stage, so entrenched in the way it's always been. And you let them just have a platform for an hour.
I missed part of it, I admit, because I was on another Zoom call. I did like the premise that I do agree that when we think about managed care and value-based care, it hasn't necessarily lived up to what it was supposed to deliver.
That's true.
And so we are paying more for healthcare today. I mean, the national conversation, the state conversation is healthcare costs more. And so I do think we could have an honest conversation as value-based care and managed care. When we think about here in Louisiana, 6 managed care companies for
it's not even commercials. And so I was talking to one of those out there and sharing. I'm like, you know how hard it is for a provider when there's 6 of you? And so do they have to take?
And several of them only have 150,000 lives, which we know isn't viable. It's not enough people for them to actually do that. And so, of course, costs are going to be higher because it's not being managed really from the state perspective. And then those MCOs are really the ones who are making decisions and pushing care. And it's different depending on which company you're with. And so I do think we have to have an honest conversation about, is managed care and value-based care actually delivering on the cost savings we were promised? And we know, and I've been around the Medicaid system in Iowa since we went to MCOs, and I heard the promises firsthand. And we know it didn't actually deliver on either the quality that was supposed to come or the cost savings that was supposed to come
and
from
maybe
it.
That's really what the guy was trying to get at. Because what was funny about him, when we said something about MCOs and whether or not, I think you said something like case management, it was him. It was that one, and that one gentleman who's now the speaker telling us how bad everything is. He just started laughing out
loud. I was interrupted
by a laughter, like, ha ha. And I was like, well, that's different.
It doesn't happen.
I mean, the room wasn't huge, but we had more interaction than normal in our conversation. They were like talking back to us. Now, the part that really before we get to some couple stories on follow-ups, that telehealth conversation got wild to me. You were trying to wrap up at the end, and they're just like, nope, the laws are wrong. We don't get paid enough. And nope, the rates are wrong. And why would I do telehealth when I could make twice as much if they walk into my clinic? That means it's all set up wrong. I'm telling you right now, that is wrong. If your state, and I just had this conversation afterwards, it's how it'll tie together. But there's a gentleman who works on policy. And I was like, as a clinician, you should get charged a rate for whatever you do. And it should be consistent across no matter where you deliver that thing. Now, if managed care argues this, if I'm doing it at home, I don't have office, I don't have secretaries, I don't have phone lines, I don't have whatever I don't have. Those should be fees tacked on for how much more you can bill with the fees, maybe, because it costs you more to do it in an institution. That's the healthcare or the insurance company's thing, is like, it costs you more because you have costs. That's a cost report. So the actual how much I get paid, though, should be the same. My take-home pay should be the same. But you have to build it that way. And I don't think it sounds like it's built that way.
Well, and I think we do have a misunderstanding what is telehealth, right? I think about telehealth being delivered in a clinic office with maybe a practitioner who's in another clinic or more of an urban area to bring access to local areas. It's not necessarily sitting at home where both parties are sitting at home. And so we do have to get probably clearer, because I think I don't always appreciate the variation in definitions of telehealth when we travel a lot because I have a concept of what telehealth looks like in my mind. It's not the same. And the definitions sometimes vary a lot state to state between which of those things they include and
Fascinating
exclude.
fact here, having talked to the telehealth company, is they have to be licensed in this state to even be able to
That's
provide
true. And
in the state.
that's common for
Right.
any
And
telehealth.
so, but they don't have to have any feet on the ground in the state,
Yep.
which is what was attempting in Iowa. There was an attempt in Iowa to make the provider
Yeah.
have a foot on the ground in Iowa
Right. That did.
to be, and
yeah.
that did, I don't know that that ever stayed.
No.
But we were talking about like there's all these rules, regulations, and I didn't realize it. Insurance companies trying to make money on this. I get it.
Right.
But when you're working, there's ways to do this different. So I was talking to one gentleman as a follow up about policy, and one of the things we did in our state was we made face to face equals telehealth in the law. And once you make it in the law that way, then it's harder for them to argue all the extras.
Well,
So they can still argue fees.
And that's remember, unless till we really dig into the issue here in Louisiana, we don't know if it's real because we know people make stuff up and start citing things that say we can't do that. And then we go back to rule, to law. I mean, this is something that Renee taught me many years ago. If you can't find the legislation or the rule or the code that says you have to do it, then it might actually not be true, even though everyone's doing it that way. It's just because one person somewhere said it one time, and then suddenly everyone just adopts that as being the law of the land. And we've seen it before where we've gone to a state and we like start reading stuff and we go back and say, hey, it doesn't say that. So can you tell me why you do it this way?
Yep.
And everyone in the room goes, I guess we don't have to do it that way.
Right.
And
That
you'll be
was my-
shocked
that was
how
my
often
ending
that.
conversation with this policy gentleman. I say, the biggest thing he needs to learn is like, show me the law, the rule, or the
Yep.
policy, because there are 3 different levels in which it says you can only do blank. Otherwise, you should assume you can do anything. I was just said that on stage. People think of the law as like a line in the sand, and I don't think of it that way. That is the barrier, but all this other stuff is fair game. And they forget all of that stuff. They argue right up to this line. And like, what about all this other stuff you could be doing?
Yep.
And a lot of people don't think of the law that way. It's laws are supposed to be there as like guardrails so you
Yep.
don't fall into ditches on either side.
Yep.
It's not supposed to stop you from doing your job. And we get very confused about that. And yeah, so the policy gentleman understood exactly what I was talking about.
And I think that's our main takeaway today here, right? Like, I think that's the title of this episode is really, we can't just believe everything the way it's presented to us. We're responsible for doing our own research
Yes.
and vetting out some of these things because it's unbelievable how often we're either at a system, a provider, or a state, and we have to get back to the root, right? We have to really research it to figure it out.
In Iowa, I mean, this is one good example, but in Iowa, I was told that we can't have Medicaid when people are on parole, when they do in many, many states. It came down to a memo written in 2016.
Yeah.
Not a law, not a rule, not even a policy, a memo. And so when I dove in and I said, okay, where does it say this, right? You get it in writing. And I'm like, well, if it's a memo, you can change a memo.
Yeah.
So it's not a law. And so it wasn't even like I had to officially do anything. I didn't have to pass a rule,
Yep.
law, nothing. I'm just like, well, you can change that.
Right.
And then some people with smarter heads prevailing now that the federal government wants you to have Medicaid before you're released from prison or jail. I'm like, well, the only thing in your way is a memo.
Right.
I'm like, really, that's not it. And so the whole state was backed on this memo. But by golly, there's a couple people that were around when it was written that really are staunch supporters of said memo.
Yep.
And I'm like, it's a memo.
Right.
It literally said
Right.
memo.
Right.
And it wasn't even of understanding.
Yeah, just a memo.
Just a memo. And so, there's things like that unless you push on it, people will say that's just the way it is. And that's like, no, I want it in writing.
That
And
one,
I don't like a pain. We're being, what was that? Not problemish.
problemish. That's right.
Problemish back in Louisiana.
But think about that. That one memo was what was stopping the whole system,
the whole dang thing.
right? Because one person wrote a memo. And so
It was like 3 Medicaid directors ago or something.
that's more than 3.
Oh.
2016 is more than 3, but we're not keeping track.
Who was in
Right.
charge back
Right.
then, right? So it's like, that's been a minute, and different HHS directors too.
Yeah, absolutely.
And so one of who's since passed on.
Right.
I mean, that's like, whose memo was this, right? So it's like, everybody thinks I'm silly when I say that, but I mean, I have real life examples. I mean,
Yep.
so some of the examples I couldn't say today on stage, there were so many things that popped into my head and I just couldn't say them. But that was one. I was thinking, oh, well, don't feel bad. I mean, I don't want Louisiana to feel bad that their state's in a mess, because ours is too. Because I'm like, hey, whatever you guys have come up with, we probably have a story to match for
Absolutely.
our state or neighboring state.
Absolutely.
Because I thought we did pretty good today. We talked about Minnesota, we talked about North Dakota, we talked about
Nebraska?
Nebraska.
Yeah.
I mean, we talked about several states. So it's not We don't want people to think, oh my gosh, it's just our state.
No, it's
Oh my gosh, it's just the whole system as a whole.
absolutely,
And we could learn working together. And
absolutely.
the big key of convening and having these kind of conversations where you can share, hey, this is what I learned in my state. This is what you learned in your state, and maybe make it better.
Absolutely.
I think that's what it's all about.
Well, what a great day, and what a beautiful day to be this late in the year and sitting outside.
Gorgeous. So I'm going to have a rural policy partner self-care tip. You have to get outside.
It's true.
So after the got off stage and I wanted to go outside, and the first person caught me like immediately. I didn't take 3 steps off that stage, one person, and it was a good 30 minutes plus. And then the next person, I was headed out the door. I was 2 feet from the outside, and she stopped me. Another 30-minute conversation. So I go to leave the second person, and the third person was like, oh, but I really want to talk to you. So I just said, excuse me, do you mind? Could we just walk outside? I said, I'll talk to you as long as you want, but I just needed to go outside a bit to get some fresh air. And we sit by this beautiful fountain. And he's like, cool, I'd like to go outside. So I was like, thank you. So we just went and moved our meeting outside. So sometimes you just have to have a break, and you can only stay so long in a conference center. I can't do it.
It's
My brain can't pay attention that long.
Yeah.
So we just needed to go outside.
absolutely.
So for all of you out there, if you've got a warmer day coming around, we're in the Midwest in winter, there's always a warm day or two. Use it, man. Even if it's 5 or 10 degrees warmer than yesterday, get out there, get outside, get some sun. You'll feel so much better.
Absolutely. I couldn't agree more.
Well, today, guys, we always talked about the Louisiana Rural Mental Health Summit, and we learned a lot. We got to speak again.
Yeah.
We're dialing in our message. Apparently, it's resonating because people are chasing me off stage. So if you haven't heard that story yet, have us come to your place. We'll tell you all about what we've learned. And where are we next? Do we know what the next conference is?
We are off for the rest of the year. I don't know when this is. I don't even know when this comes out, but we are out until 2026, and then we'll have a whole new schedule.
The cap for 2020.
This is the cap.
Awesome is that. Well, we'll see y'all next time, guys. Have a great day.